at the University of Virginia. He did his medical school training at Eastern Virginia Medical School, internal medicine residency, and chief residency at Georgetown University Hospital. Dr. Chapy joined Inova in 2004 as an internal medicine doctor practicing hospital medicine. He was named Vice Chair for Quality and General Medicine in the Department of Medicine at Inova Fairfax Medical Campus in 2012. He obtained his Master's of Science in Quality and Safety from Northwestern University in 2016. Thank you for being here tonight, Dr. Chapy. The next speaker is Michael Forehand. Mike is an experienced government, community, and public relations professional who serves as Vice President of Government and Community Affairs for Inova. He is responsible for government relations and advocacy at the local, state, and federal levels, and managing Innova's community engagement across Northern Virginia. Prior to Inova, Michael served as Senior Vice President at the Northern Virginia Chamber of Commerce. He was responsible for government relations and advocacy at the local, state, and federal levels on issues related to the business climate in the Northern Virginia region, as well as public affairs, communications, and marketing strategy for the Chamber. A Northern Virginia native, Michael is a graduate of Fairfax County Public Schools. He earned a bachelor's degree from James Madison University and a Juris Doctorate from the Washington College of Law at American University. He serves as Vice Chair of the Board of Directors for Virginia 21, a statewide leadership and higher education advocacy organization, and serves on the boards of the Northern Virginia Community College Foundation and the Arts Council of Fairfax County. Michael is a member of the Virginia State Bar and previously served as Vice Chair of the Fairfax Chamber Policy Committee and as a member of the Nova Biz PAC Board. In 2016, he completed the Political Leaders Program of the Sorensen Institute of Political Leadership at the University of Virginia. Thank you for being with us tonight, Mike Forehand. Thank you so much.
Well, thank you all so much for, can you hear me just fine? First question, can everyone hear me?
Yes.
Wonderful. Thank you all so much for the opportunity to present to you and asking us to share sort of our story and provide our context on Inova's COVID response and how COVID is progressing through our community and how we've been able to respond since this all started unbelievably in February. I'm going to go ahead and share my screen and cross my fingers that it works, because we have a few slides to just run through to talk about high-level concepts, and then we want to make sure that we leave as much time as possible for your questions on COVID-19. Can everyone see the slides that I put up? We're good to go?
Yes.
Excellent.
Yes.
So just very quickly about Inova. I know many of you probably know a lot about us, but just wanted to give you sort of the context of our system. So we are Northern Virginia's leading not-for-profit healthcare provider. We've been serving the community since 1956, when a number of folks in Fairfax County around a kitchen table decided to form the Fairfax Hospital Association and started the groundwork for the first hospital in the Inova system. The Inova Fairfax was now known as the Inova Fairfax Medical Campus. Today, since then, we are an integrated network of 5 hospitals, emergency, urgent care centers, primary care, outpatient, an integrated health system serving the Northern Virginia community. We serve more than 2 million patients annually. And importantly, we employ more than 18,000 in Northern Virginia. We are the largest private employer in Northern Virginia. At least we are until Amazon gets really ramped up in our region. And one thing we're very proud is our not-for-profit background. And what does that mean? That means that we are a community partner. You are our bosses. We serve you. And as part of that, we have a commitment to contributing back to the community. Last year, we contributed $323 million in community benefit back to Northern Virginia, and that includes $130 million in charity care. As a not-for-profit healthcare provider, we see all patients regardless of their ability to pay. So we have a robust charity care program to ensure that no person in our Northern Virginia community goes without the care they need to enrich their lives. This year, we are nationally recognized in a number of areas. We're the only large health system in the country to have each hospital rated 5 stars, the highest level, by CMS. CMS is the Centers for Medicare and Medicaid Services. They are the largest payer of healthcare services in the country, overseeing Medicare and Medicaid. They just started rating hospitals across the country just a few years ago. We're the largest system to have each of our hospitals rated 5 stars for quality and safety, and that's because of the great work that our team members do and the work that Dr. Chapy oversees, and he's going to speak to some of that work and the work we've done on COVID-19 in just a few minutes. Additionally, U.S. News and World Report, which also recognizes hospitals and health systems across the country, has rated Inova Fairfax Medical Campus as the #1 hospital in Greater Washington for the 2nd year in a row. And then also, we're very proud to have our gynecology program rated #9 in the country. This is a really, really proud statement for our team and for our system, in fulfilling our mission, which is to provide world-class care to each person in every community we have the privilege to serve. As part of that and fulfilling our mission, COVID-19, we took very seriously very early. And before COVID was even in the United States, when it was still something we were hearing about as something that was impacting China and impacting maybe a cruise ship in a faraway body of water, we established what we called the Inova COVID-19 Coordination Center, and we call it IC3 internally. And this was really the group that was put together to say, all right, we don't know if this is going to come to the United States. We don't know to what level. We don't know to what impact, but we're going to start preparing now. So that was January 16th. And I'm not sure in January 16th we could have ever known that we would be where we are today. But as this progressed, and once we realized that this was going to be something that was going to be impacting our community in a really significant way, the Coordination Center became the centralized sort of multidisciplinary hub to guide the response for all 5 of our Inova hospitals: Inova Fairfax, Inova Mount Vernon, Inova Alexandria, Inova Loudoun, and Inova Fair Oaks, as well as all the things that were going to be needed to be done to address COVID-19. So with that group, that was 7 days a week, 12 hours a day, working to develop our response, answer questions, and be the centralized hub for all that activity. These were clinical teams and non-clinical teams, obviously led by our infectious disease and infection prevention folks, identifying and understanding what COVID-19 is and how we can prevent it in the community, but also within our facilities. Obviously, extraordinarily important, supply chain, ensuring that we have the ability to acquire all the materials, the PPE, the personal protective equipment, PPE, all the materials we needed to manage this response. Patient experience being a forefront of this, and ensuring, because the patient is the #1 value that we have: patient always, patient first. Our nursing and our physicians, obviously, emergency management, because this is truly a coordinated response, and as we've seen from the governor and the president, a true state of emergency for public health. Employee health, we call our employees team members, obviously critically important to ensure that we have a streamlined manner to address, if our employees, our team members do happen to contract COVID-19, how do we ensure that they're safe? How do we ensure that they're able to effectively quarantine, and then once their condition has subsided, come back into the workforce to support our patients? Laboratory and testing and obviously being testing and ramping up a testing strategy for Inova and for Northern Virginia. And then also, near and dear to my heart, because this is where I sit, external and internal communications, being able to share all that information in a way that makes sense for all of our patients, all of our team members, and the community at large. How do we do that? Daily updates to our hospital teams, multiple times weekly huddles with all team members across the system, cascading that critical information as to how we care for patients, how we're going to respond to the needs, how we have to change the way we do business, and all those things around there. Chapy, I'm going to ask, is there anything that I'm missing on IC3 before we jump on to the next discussion?
No, I would just want to add that it was probably for me as a professional, the most gratifying and challenging work that I've ever been a part of. I learned this acronym called VUCA, V-U-C-A, which is supposed to stand for volatile, uncertain, complex, and ambiguous. And that was really how it felt, COVID-19. There were so many uncertainties, so many complexities, a lot of ambiguity, but really the way that we were able to transcend that is coming together as a team, really giving everyone the space so that their voices can be heard, so the best ideas come out. And I really think that had a lot to do with how we were able to succeed in our response. And again, it was the most humbling work I've ever been a part of.
Thanks. Thanks, Chapy. I couldn't echo that more. It truly was an unbelievable team effort, and people dedicating themselves towards this goal. And as a non-clinical person, as someone who's never going to care for a patient, to me felt the closest I was going to get to really having an impact on a patient and our community. And so it really was extraordinarily gratifying. And I'm grateful for that opportunity to have been a part of it. Where we are today, from an Inova perspective, Inova is not the only, but we are the region's leading healthcare provider. We have seen a tremendous amount of COVID patients. Thank goodness Northern Virginia was never in the place of like New York or Houston was a few months ago, or Italy or any other place that you've seen in the news. Thankfully, we were never there, but it certainly has been a long and tiresome ride for our clinical teams. To date, we have treated just over 3,500 COVID-19 positive patients in our 5 hospitals. That accounts for about 20%, maybe 22% of all the hospitalized COVID-19 patients in Virginia. So without question, Inova has seen the largest percentage of any hospital or healthcare system in Virginia of COVID-19 patients, which shouldn't be surprising considering Northern Virginia is so populous, particularly when compared to other parts of the state. Today, we are at just around 70 patients across the 5 hospitals. So compare that, what does that mean? Compare that to May 1st, where we had 415 patients in those hospitals. So we are in a much better place today in Northern Virginia than we were at the peak of this. Testing, we had realized very quickly that just like all across the country, we needed to be a part of testing in the community. So we've tested patients through our hospitals, through our primary care sites, and we established curbside testing sites across, we call them respiratory illness clinics. One at Dulles South in Loudoun County, one at Tysons, one in North Arlington, and one in Old Town Alexandria. And they have additional testing site at the Ashburn Healthplex in Ashburn. So those are curbside testing sites where folks with physician orders can go get you've seen it on TV, get a Q-tip stuck up your nose and get a sample collected for COVID testing. So to date, we've tested just under 90,000 people in Northern Virginia, and that's been a significant effort that we've encountered to really get out the testing capacity in our region. Really wanted to emphasize to this group how important it is, you know, if the patient is first, our team member is just behind. We got to make sure we protect our team members. And that is exactly what we did. We spent $34 million in the month of March alone on personal protective equipment, safety construction, so building of those negative pressure rooms that contain or help contain a virus, and then other equipment for safety. We continue to make those investments to ensure that we have an adequate supply of PPE. Certainly, it was tough at times to ensure that we had all that PPE. You know, our CEO, Dr. Stephen Jones, I think said it best. We've always had enough PPE, but not enough that we could squander. And so it was really important for us to ensure that we preserve the PPE and we're good stewards of those resources, because not every hospital in America had that same fortune and the great work that our supply chain team did to ensure we had PPE. And then the last thing I'll mention on COVID response particularly is telemedicine. You know, you all may have, I'm sure many on this call have had a virtual visit in the past 6 months with your doctor, which is different and new, but it is going to be the new normal going forward. We went at Inova from next to no telemedicine virtual visits in January to in May at the peak of COVID-19, 70% of all of our visits were virtual. And that was by necessity. It was an unbelievable Herculean IT effort and change in people's mentality and approach, but we see that people are liking it, and it was going to be part of our strategy anyway as an organization to start looking at telemedicine in the next few years. It's just COVID-19 has been an accelerant to making that happen, and it is going to be part of the new normal, or what we call the next normal. One of the things that I know this group wanted to hear about was talking about impacted communities and the disproportionate impact that COVID-19 has had on people of color, not just in our community, but across the country. In Northern Virginia, it has disproportionately impacted the Latinx community, the Hispanic community in our region. I'll give you the example that I like to share to talk about the magnitude of this. In Fairfax County, Latinx individuals account for 16% of the population, but 15% of all COVID-19 cases. And that is an unbelievable statistic, but of course we're seeing it across the country that it's impacting Black and Brown communities more than any other. So how are we responding to that? It's particularly in low-income communities that we, as a nonprofit healthcare provider, as providing community benefit to support these, the communities don't have necessarily all the access to healthcare services. We want to ensure that we close that gap. And so after the Medicaid expansion a handful of years ago, we established Inova Care's clinics for families, which are primary care medical homes for those who are eligible for Medicaid, those who are eligible, which is Medicaid, as opposed to Medicare, for those who don't know, is state-run, federal-run health insurance for low-income populations, as well as those who are uninsured at Inova Care's clinics for families. They're seeing these patients. We doubled the number of our physicians and other healthcare providers at the Inova Care's clinics for families just to meet the need during COVID-19. And a big part of that was also telemedicine. We're doing telemedicine screenings for folks that are going to our Inova Care's clinics. We were doing that via video, via Zoom, via phone. However we could get to them, we could. We screen them for COVID-19 symptoms, and then provide no-cost testing if that was appropriate, or in this case, clinically indicated that a test was appropriate. We have a very robust language services program to ensure that all of our materials are provided in multiple languages, and in fact, the top 8 languages in our region. We translate those documents into, obviously Korean, Chinese, Vietnamese, Haric, Spanish, obviously, and a handful of others. So we're really keen on that. And then one thing I wanted to highlight was our Inside Out initiative, and this was something that I've been really pleased to work with Dr. Chapy on, in talking about how our team members could be ambassadors for Inova and ambassadors for the right messaging on COVID-19 in the communities they live in. So we went to our team members who speak Spanish and may live in communities that are disproportionately impacted, and provided them with the information so they could echo the important health information that we were trying to get out there, but they could do it as a trusted messenger. And that was a really exciting program that was an idea from one of our fellow team members who said, hey, we should be educating our own people so they could talk to their friends and neighbors. Chapy, am I missing anything on our social determinants work that we should be highlighting?
No, I think you got it all. I think that's correct. And in terms of hospitalized individuals, the Hispanic and Latino ethnicity was really half of our hospitalized individuals. So in line with the number of cases in Fairfax County as well.
Excellent. So I'm gonna take a break and kick it over to Dr. Chapy to talk through some of the key parts about COVID-19, how it is as a virus, and how you can be helpful in protecting yourselves, but also protecting the community. So Chapy, kicking it over to you.
Sounds good, Mike. First, before getting started, I did want to mention to all of you, this is an honor to me to be able to participate in your meeting today. One day, hopefully, we'll get back to in person and not virtual. Maybe I could come back and we could talk about something else. But thank you, Mr. Calandria, Dr. Jackson, and Mrs. Rizvi for the introduction. And thanks to all of you for joining. As we mentioned before, COVID-19 is certainly something that really has caused us to need to learn very, very quickly and on the fly. So if you all remember, actually it wasn't always called COVID-19. That was a new name that came up. Initially it was called SARS-CoV-2, and eventually renamed to COVID-19, and that's the name that is stuck. But very, very important from a public health perspective. And what makes this virus so challenging is that it is a virus without a cure at this point. And so the medications and medical treatments are all supportive in nature. And what that means is essentially doesn't necessarily cure the virus itself, but does allow your body to recover and use its own recovery mechanisms. There is a very, very broad range of symptoms, as you all know, and severity. And that's what makes this very, very challenging to understand whether one is actually infected. That's what makes this a very, very challenging virus and public health phenomenon. So it can be all the way from no symptoms whatsoever to mild symptoms such as loss of smell or loss of taste, to then some of the more classic symptoms like fever, cough, and shortness of breath, all the way to very, very severe illness that required being on a ventilator or being in the intensive care unit. So a very, very broad range of what this virus and disease can look like when it manifests in us. And obviously you all have heard, and very, very important to continue to reiterate that folks are actually contagious before they develop symptoms. And that's what makes things very, very challenging. So there's a period that's called an incubation period. that's really where there's no symptoms at all and there's no disease, but the virus is there in your body. Then there's what's called the pre-symptomatic phase, where before individuals who develop symptoms might have a few days before that, before they develop symptoms. Then there's the symptomatic phase, and then there's recovery. Now in there, sometimes folks cannot have any symptoms the entire time. And that's what, again, makes this that pre-symptomatic phase, and folks actually having the actual virus without any symptoms at all is what makes this very, very challenging. Most public health and infectious disease experts will say that contagiousness really is much more likely in the pre-symptomatic phase than it is in those who are asymptomatic the entire time. The challenge is that differentiating those two in real life is very difficult. Regarding testing, there's multiple, obviously, in the news, and for us, even at Inova, and I think all major healthcare systems are frankly struggling with the testing infrastructure that's in place in our nation and in our communities. Testing is very, very important, and can tell I'm an internal medicine doctor and I rely on tests to help me all the time. And this one was a little bit different because you may have to actually think through things without the benefit of a test or while waiting for the results. There are different types of tests that are out there, and we can certainly get into that during the Q&A. And there's different purposes for testing. So some would be to, if we see somebody with symptoms, to actually obtain a test to confirm the presence of COVID-19. And that helps us because then we could administer the right supportive treatments if needed, but more importantly, help inform self-isolation for a certain amount of time to ensure that it's not spread, and to keep a close eye on symptoms in case it gets more severe. On the public health angle, there's a slightly different purpose for testing, and that's really more to be able to do what we call surveillance, general surveillance of our population, to understand how many individuals out there and in what areas could there be clusters of infection. There's a mantra in public health, which is called test, trace, isolate. So the idea would be to test individuals. If they are positive, then we like to do what's called contact tracing and talk to folks they've been in contact with and potentially test those individuals and have folks isolate to protect others. We could go to the next slide, Mike. So this is, I'm sure, things you all have heard often, but it is always very, very important to reiterate, which is essentially, well, the bottom line is because this virus does not have a cure at the moment, that really, really the best mechanism to protect all of us is to prevent catching the virus in the first place. And there are certain public health measures that can be put into place and personal choices that really are effective in stopping the spread. One of them is certainly wearing a mask. And I think some of the questions that had come up is, well, what type of mask is appropriate? I think that what's more important than the type of mask is actually wearing it properly. That it should cover the nose and extend all the way to below the chin, cover the entire mouth and nostrils, and fit as snugly as possible. For cloth face coverings, they need to be able to be laundered. I'm a eyeglasses wearer, as you all can see. So having the mask that can give a little bit more pinch, so there's not as much air that goes up to the glasses, really helps my day-to-day and my vision. Probably that pinch to that degree does not provide that much of a significant difference in transmission of virus. Next is really washing your hands. So it seems very simple, but the single most important thing that any of us can do to prevent the spread of any infection is to perform proper hand hygiene. So washing your hands frequently is very, very important. Disinfecting frequently touched surfaces. That's another one that our CDC recommends and is a really good idea. Keeping physical distance from others that are not in your household. I personally don't like the word social distance because it implies something a little bit different. I think right now we're socially distant also because we have to interact in different ways than we used to, but really physical distance from others that are not in the household. And you all, I'm sure, have heard about the idea of 6 feet, and where did that actually come from? And the general theory is that viruses that spread through what are called droplets, they eventually over time will drop. So therefore droplet through gravity. And the idea is they would drop to the lowest surface before it reaches 6 feet of traveling. The other type of transmission that has been debated is airborne transmission, which would mean that the virus actually stays suspended in the air for a long amount of time. There's still some controversy about which it actually is, but the balance of evidence does indicate that this is spread through droplets and not airborne. And that is why, I'll give you one example. I don't know, have any of you heard about I believe it was in Missouri, the hairstylist who had COVID? So there was a hairstylist, this was early on, this was probably in the April timeframe. She ended up developing symptoms and had COVID, and unbeknownst to her had taken care of and done the hair of, I think, approximately 130 individuals. But she wore a mask, they wore masks, and none of them acquired COVID. They were tested and none of them developed COVID or symptoms. So there's a lot of basic things we can do to help prevent the spread. And then finally, if you are sick, it's really important to stay home and call a physician. Next slide, Mike. Mike, is this one for you or me? I can't remember.
I think we can sort of tag team this one. I mean, one of the items that when we was talking about this presentation was how do we have safe meetings? When can we come back and meet in person again? If we want to meet in person, how do we do it safely? Some of you may own businesses or operate businesses and wonder, how do I keep my workplace safe? And I think from us, and I'll kick it over to Dr. Chapy to talk a little bit more about this, but we say, all right, follow the trusted resources, right? CDC, Virginia Department of Health, your folks that are looking at this thoroughly, and physical distancing, mask wearing, all those are critically important. One thing in Virginia, and a good guideline, the Department of Labor and Industry put together a group of folks from business to labor to folks that are working in farms and factories and all the different entities in Virginia to come through with safety measures for all employers in Virginia. And this provides a pretty comprehensive look. I think we're the first state in the country to do this, to establish guidelines for how to safely operate a business in Virginia. Obviously, there are questions about do you need to go to the level of what Dolly says or not, or what have you, but at least from a guidelines perspective and where to look, this is a pretty good place to look. And these are mandatory guidelines for all businesses in Virginia. So just wanted to highlight that as a resource to mention. So did I miss anything there, Chapy?
Nope, I think it's really, in the end, most of these, Dolly is obviously, really becomes a, mandatory and legal as opposed to guidance. But really, in the end, a lot of it is basic practices of setting up workspaces for distancing, wearing masks, ensuring adequate supply of hand hygiene, and ensuring at least a self-check of symptoms and temperature.
Okay, I think we just have a few more, and then we'll get to your, like I said, provide plenty of time for y'all's questions. Obviously, you know, we have a lot of partners in ensuring that we can be on the front lines of stopping COVID-19 in Northern Virginia. We have our health departments, our local governments, the Virginia Department of Health, our federal partners at the CDC and Health and Human Services, our federally qualified health centers and other healthcare providers that are you know, meeting the needs of the community, our fellow hospitals. We work closely with our hospitals, but the best partner that we have are the people that we serve. As Chapy said, I mean, it is about the best way for us to stop COVID-19 is to be able to tell you and educate you on how to prevent it for yourselves. So your partnership in this is incredibly important. And as Rotarians, you know how to serve the community, and here's a few ways that you can do it. Blood donation. We are accepting a blood donation and doing blood drives in a safe way across Northern Virginia through Inova Blood Donor Services. And we continue to see a shortage of really needed blood products. While we were pleased to see during the safer at home, stay at home orders, you know, fewer folks coming into the hospital for car accidents and, you know, all the other things that you see at a hospital every day. We still need blood products to save lives, and blood donation does save lives. So if you're looking for a way to help, that's a great way to do it. The website for that is inovablood.org. It couldn't be easier. And that doesn't just support Inova hospitals. We supply donated blood to hospitals all across the greater Washington region. If you have had COVID-19, or you know people that have had COVID-19, your blood plasma may help a patient with the virus. And Chapy, I want to kick it over to you to talk a little bit about that, just because I know that's been in the news a lot recently.
Yeah, I think that, so we're talking about COVID convalescent plasma. And essentially the idea is that potentially receiving plasma from an individual who's actually already recovered from COVID could actually improve the recovery for somebody who currently has COVID. That's the theory behind it. The studies are still being worked on. You know, certainly that's one of the things that we've really, it's been a new world with COVID and evidence. Usually we're able to see a nice, clean, peer-reviewed paper, which usually will take a year to a year and a half to be put out and goes through a very rigorous process. Now, because of the urgency to be able to understand what the new treatments are, sometimes the studies come out quickly, and then we end up finding out that through follow-up studies that what was initially thought to be beneficial is no longer so. And so I think certainly the FDA has offered or arranged what's called an EUA, which is an emergency authorization, emergency use authorization to use convalescent plasma for the treatment of COVID-19. And that's certainly why building up our stockpile is a good idea. But certainly if data eventually comes out that would be contrary to it being a benefit, we're evaluating all of that really on a daily basis and modifying our protocols very rapidly.
So, so the point there is blood donation is key, and you could obviously save somebody's life with that. Flu prevention. We are getting into flu season. It is time to get your flu shot. Please get your flu shot. At Inova, we have community flu clinics. You can go to inova.org/flu to find out about that, or you can go anywhere, your CVS, your doctor, you know, what have you. And then as Chapy said before, the best thing you can do, wear a mask, wash your hands, practice physical distancing.
I just want to add things to that, Mike, if you could go back for a second. Just want to add things. Just to make sure I draw the connection, because, well, really what would be, you know, influenza, and we're talking about COVID-19, But it's very, very important. If you all recall, influenza in its own right is a major, major public health issue. It's a very, very common cause of severe illness, especially in those at risk or the elderly, and a very, very common cause of death in the elderly. And so under normal circumstances, it's extremely important to protect ourselves and receive the influenza vaccine. We have some information from the Southern Hemisphere, because if you remember, the Southern Hemisphere, usually their influenza season happens earlier than ours. Through things such as vaccination campaigns and masking and distancing, they've had very quote unquote quiet influenza seasons actually. And what that does is a few things. It helps us on an individual basis, because then if I as a physician see a patient with fevers and cough and it's influenza season, it's not always straightforward for me to know whether that individual has COVID or influenza. So for us to be able to decrease the chances of influenza is extremely important. The second is what we had heard about before in terms of that whole idea of flattening the curve. The same concept applies, is that if we can perform these right public health processes, then the risk of overwhelming our healthcare system because of both COVID-19 and severe influenza will be decreased. So it is truly, truly a way not just to help each of us who receive the vaccine, but is truly a way to actually help protect the healthcare system from becoming overwhelmed during the peak of the influenza season.
That's critically important. Thanks for bringing that context in. During the COVID period, we saw a tremendous drop in folks coming to the hospital and people saying to us, listen, there's COVID-19 in the community. I'm scared to go to the hospital. And that's certainly understandable. And, one thing, we put in a tremendous amount of protections, precautions. We stopped all elective, non-urgent surgical procedures voluntarily before the governor placed an executive order stopping them altogether for almost a month and a half. But once we started to come back, we were starting to see folks just feeling uncomfortable. And so one of the things that we truly want to leave you with and emphasize to our community is that you are safe at Inova. And we have a campaign out, you may have seen it online or on television or on the radio, about what makes us safe and what we're doing right now to ensure that you are safe, whether it's going to your primary care physician or coming into the hospital or going to the emergency room. And that's in talking about, what procedures we put in place to ensure physical distancing, isolation of COVID patients, and symptom screening and temperature checks. We have universal masking at all Inova facilities. You must wear a mask if you are coming into an Inova facility. You will have symptom screening before coming into an Inova facility. Our practices, our supplies, ensuring you have sufficient PPE, and then cleaning, obviously rigorous cleaning of all of our clinical spaces to ensure that we can rid of any, whatever is in there, flu virus or COVID virus. So, these are the things that we're doing to ensure that you're safe. And that's something that we want to emphasize to you. So, because the most important thing is, if you're having an emergency condition, to not delay your healthcare. And that's the message we want to get across. Chapy, anything you want to get on that before we?
Yeah, I think that's very well said, Mike. I think we want to assure you, actually, I would venture to say that the hospital and our healthcare facilities are among the safest places now. And really what we notice as medical professionals is that even common things like high blood pressure, diabetes, obviously there are definitely telemedicine approaches to getting care. But even when it comes to non-emergency conditions, we certainly want folks to really have continuity of their care. Because what will happen is that if those diagnoses are left uncontrolled, something more severe can happen later on, and that matters to us that we avoid that. And in fact, you'll notice that during all of this, one of the things that stayed open were pediatric clinics to be able to give immunizations on schedule. And so really along those same ideas, really we encourage for urgent and emergent, absolutely seek immediate medical attention, but also for other chronic health conditions, don't put that off. We've got stuff in place now to do that very, very safely.
And we're going to wrap up to go to questions. And as I see it storming outside my window, I'm hoping the power doesn't go out. But I just wanted to share these because I mean, really for us, as on behalf of 18,000 Inova team members, I mean, really want to thank you and thank our community for the support. I mean, it's just been truly unbelievable the amount of support that our frontline team members received during the COVID period, and the gratitude is tremendous. You know, for those of us not on the front line, we still felt it too. And these are some of my favorite pictures from each of our hospitals from what we've seen, you know, between the siren salutes of the police and fire running their sirens up and down, to the Blue Angels flying over Fairfax Hospital, to, you know, kids, you know, coming in and calling our nurses and doctors superheroes, to the food, the amount of food, oh my gosh, the amount of food that we received from restaurants who came to support. I mean, just tremendous. So we want to thank you for your support and leave you, it was going to questions. Just the last thing is, trusted resources are really important. You know, in ensuring at this time that we have accurate information about COVID-19 and healthcare. So good resources, inova.org/COVID-19 has lots of information about COVID generally, but also where you can go, how you can access Inova if you suspect you have COVID-19, and it also had lots of information about, you know, what we've done with visitation and all other things related to Inova. But then also the Virginia Department of Health, the CDC, these are all trusted resources to provide accurate information. So with that, I will stop sharing my screen and open it up to questions. Thank you for the opportunity.
Thank you. If you are interested in having a question, you may feel free to include that question in the chat box, if you will. We will be monitoring the box. You can raise your hand as like this. If you just don't feel that you can manage under the participant tab, there is a raise hand feature that you can find, and it will raise a hand for you. So either way, we're here, and my co-concierge, Rene, up there, we're going to monitor the screen to make sure that we get everyone. And I see Rotarian Joseph has his hand raised. You might unmute yourself, yes.
I have a question regarding the possible infection due to circulating virus particle in the blood donors to the recipients. Is that you do a special treatment of the blood coming in, receiving from any patient, any person? I know that circulating antibody may be useful, but they may still have circulating virus particle in the blood.
Yeah, great question. So it's actually not so COVID-19 compared to other types of infectious agents like Ebola, for example, is carried through the blood. Hepatitis is transmitted through the blood. HIV is another one that can be transmitted through the blood. COVID-19 and some of these other respiratory illnesses and viruses like influenza are not transmittable through the blood. The only thing, and you make a great point, is that the antibodies to any of these infections will turn up in our blood, but that doesn't mean that that is where the infection is or is transmitted. So when you see things, for example, like illness that's occurring outside of the lungs, so that might make us think, well, oh my gosh, well, it must be the blood that's carrying it everywhere, which is a reasonable thought. However, that's most likely our body's immune response to COVID-19, but it's not at this point transmittable through blood.
Rotarian Bilal?
My question is regarding your comments about testing. You said that the pre-symptom phase is the most dangerous in terms of transmission. And our political leaders have been talking from both sides of their mouth, and some saying we should stop testing, some saying we should do more testing. As medical professionals, how do you feel about this? Should everybody be tested? Thank you.
Yeah, absolutely. Mike, did you unmute?
Well, I'll kick it over to you, Chapy, because I know there's a lot of discussion around, how do we manage the appropriateness of getting a test versus the supply that exists. And, that's a really important, I talked about us, Inova, being good stewards of the personal protective equipment that we have, but also critically important being good stewards of the testing capacity that we have and ensuring that we balance appropriately the supplies that exist that in many cases are on allocation from the federal government. It's not like we can, go down the street and buy as much as we want. What I've said to many folks around testing is that this was a matter of financial resources or expertise or having the best supply chain team in the country, which I think we do. We would have all the tests in the world, but it's not a matter of those things. And so it's balancing it appropriately from a clinical perspective. And that's where I sort of kick it over to you, Chapy, to talk about the clinical part of that.
Yeah, I think it's a great point and a great question. Do I pronounce your last name Rashid?
Yes, Rashid.
Mr. Rashid. I think it's a really, really great point. And I will tell you, me as a clinician, we always want to have as much as at our disposal as possible. But one of the interesting things that we've noted actually is that there is a possibility of too much testing, even in somebody who actually had been positive. So what we noted early on is that we would actually try and, after somebody was diagnosed, we would try and prove that they're cured by doing another test. And what we found very often is those tests stayed positive for a long, long time, for weeks, sometimes months. But really clinically, they were so much better. And what we learned over time through other studies is that those tests being positive still were indicative of virus that had already died. And so we're learning a lot about different tests, and certainly right now, all of Mike's points are very appropriate. I think that if it was a matter of quote unquote throwing as many resources as possible to be able to get as many tests as possible, we would have done it by now. I can tell you that we feel comfortable being able to test a lot of patients, including those who have symptoms, most importantly, but also those that are undergoing procedures and other high-risk endeavors up front. So I think that hopefully answers some of the question, and I think that someone in the chat also had along the similar lines type of comment / question, which it looked
Yeah, there
like.
was a question about another question was, they were concerned that the CDC or the FDA had been politicized, and obviously, someone who works in politics, in my day job, I certainly understand the concern around that, and how everything seems to be political in the year 2020. That's part of the one thing I would say to you on that is, the resources that last slide that I shared is that here are the resources. There's the Virginia Department of Health, there's the CDC, there's Inova's resource. Pick your trusted healthcare provider, and they'll be able to guide you through the COVID-19 experience, and that's sort of what I call it. I don't really know what other what other word to to say on that, because from us, from an Inova perspective, we're taking in information from many different places. Obviously, we're looking to the CDC, we're looking to our state partners, but Chapy and his team look through the medical resources from all over the country and all over the world. So there are a number of trusted resources out there. It's just, it's not necessarily what you see on Facebook or Twitter. It's, if it's got a .gov or it's got a .org on it, you're in much better shape.
I do want to answer though from Lori. There was also a question. I think when there's double questions in Zoom, it's hard to see them all.
There was how long does it take to get a test result?
One of them was, how long does it take to get a test result? And so we do, there are different types of tests that are out there at this point. So you all have probably heard from that there were self-administered tests to be able to be done at CVS type places that are monitored by one of their staff. There have been things in the news about saliva tests, for example. But the main tests right now that we have are really two types. One is testing for antibodies. That's a blood test. What that tells us is really what was the exposure to COVID-19. At this point, that's all that it tells us. So it does not tell us, for example, like other viruses, that if I have antibodies, that means I'm also immune and protected. We don't have enough information yet about antibodies to be able to make that claim. Then there are actually tests for the virus itself. And there's two types. There's one called an antigen test, which is essentially just testing for the proteins on the outside of the virus. Then the other is called what you all may have heard of called a PCR test. And what that is essentially that the specimen is put through a machine, and it's what's called amplified. So I don't know if you all back in the day had amplifiers for your stereo systems. And if you push the amplify button, then really it would get really loud. And so this is kind of the same thing. They would amplify small amounts of the virus so that it's actually detectable by a test. There's different varieties of this PCR test. One is a rapid test. You all may have heard stuff in the news about this rapid test by a company named Abbott. And this rapid test is really designed to give results all in from the time that the specimen is collected to resulting pretty rapidly within 1 to 2 hours. Then there is our standard test, which we have multiple options through our Inova Central Lab. Those tests take about 24 to 48 hours to come back, depending on what the load is at the lab. Then there are commercial lab partners, such as Mayo, Quest, and LabCorp. There have been issues because of the amount of tests that they received, that sometimes the turnaround time was really, from a clinician's perspective, unacceptable, and frankly would not help me at all. So if I perform a test on somebody and I have to wait 7 days, I might as well not perform the test and just presume that you have COVID. And so, but for our Inova Central Lab, we're looking at about 24 to 48 hours, mostly around 24 hours.
Thank you. President Ambreen, I saw your hand a little bit ago. Question, please.
Yeah, so I have 2 questions. Number one is regarding the PPE. Mike, you did indicate that you obviously Inova invested in a lot of money, but I do understand that despite that, I know a lot of people in the communities that were, started making masks, providing the gear, for the forefront, workers there. So I just wanted to understand from that aspect. And my other question will be more for Dr. Chapy. They did say that in the month of October, obviously they're pushing to get the flu vaccine, but they are anticipating another spike in the COVID-19 numbers. And I just wanted to know what kind of advice can you give us in our communities, and if that spike is just fictional, or do you think that it will or can actually happen?
So I can start on the PPE question, and thank you for that. And Dr. Chapy just can roll into the next one and provide any additional context. There were obviously, one of those things that was tremendous about the community response was, yes, people coming to us and saying, hey, I'm sewing masks. I've got 5. Can I send them to you? That was one of the most heartening pieces of the response. That was great. What was particularly impactful for us was some of these companies that would say, hey, we want to donate 50,000 surgical masks, or we want to donate 10,000 N95 masks, and there are all these different levels of masks and protection. From a clinical perspective, and I'm going to look to Chapy on this because I'm quickly getting outside of my lane. But when we were looking at how we rolled out our PPE, it was what's the right PPE for the right setting, for the right patient, and to protect the team member as best as possible while being good stewards of the PPE that was available to us at that time. And I do not know of any period during the COVID response where in a clinical setting where someone's taking care of a patient, that one of our team members was using a cloth mask for, that you said. Now, is that acceptable for someone going to the grocery store? Of course. But there are a number of different ways that we can address the PPE challenge through the sort of traditional, I'll say, PPE avenues that we have, and the more traditional equipment that we have. So Chapy, I'll kick that over to you to correct me where I'm wrong or add on to that. I think you're on mute, Chapy.
Okay, there you go. Sorry about that. So yeah, nothing else to add regarding PPE. We did institute an interesting innovation at Inova for our team members. We did actually implement some version of industrial masks that really could be reused frequently, that are actually not out of cloth or fabric or that surgical type material, but it's actually out of plastic, and that the only thing that would need to be changed are filters within it. So that has really allowed us to conserve a lot of our disposable supply because to your next point, we really want to be in a position that if and when things spike again, that we're ready and that we've got all the protections needed for our team. And I would say as a leader, it's one of the most humbling experiences that I've been a part of, because I can't think of anything where we've been confronted with a disease that actually the caregivers had such a risk of acquiring the same fate as the patient. And that's pretty weighty and why we've been so careful. I think your other question was about, do we expect a spike in October? And if so, what should be, what as community members can be done? Is that the other? So we do try and use multiple different predictive models that incorporate a lot of different things, including positivity rates, including what's happening in other areas and other statistics. It is possible that there would be a spike in October, but I would honestly say it's possible that there won't be. It's possible that there will be one later. So I don't know anything really special per se about October, except to say that typically you'll see in many of the models that are out there, there was one from the University of Washington that was really, really good. And I think anybody can log on and check it out. But the main factors that actually influenced what the predictions were the presence of what the governmental orders were. and what the extent of social distancing was in that area. So I think that as a community member, I think continuing to really promote what it is that we mentioned about keeping yourself safe and keeping others safe. I think that in the end, regardless of if we're in a spike, if there's one coming, or if we've just gotten over one, those would really be the things that can that you can do as a community member to help as a trusted messenger.
Thank you. Rotarian Yasmin has a question, and before we allow that question, I just want to point out in the chat that Mr. Folan and Dr. Chapy have listed some websites if you'd like to make note of those for additional information. Okay, thank you. Rotarian Yasmin.
Yes, thank you. Thank you, Dr. Chapy and Mike, for doing this for us. My question is, I have two nephews who are identical twins, and one got infected in April. They're 29 years old, and literally both actually got infected, but one ended up in the ICU for 17 days. He was extremely ill, and the other brother shook it off very easily, like 3 days, and he was fine. So for us, it was very puzzling to see these two kids that look exactly alike, they think alike, and one just went down so bad. We almost lost him. It was really, really bad for him. So how do you explain that? Or nobody can explain that yet?
Yeah, well, maybe we can partner and try and figure it out, and then we'll win the Nobel Prize. So no, I really do think that actually that's a great question. And I think that in addition, very, very interesting that they're identical twins. I'm presuming they're probably hanging out together also, so probably were exposed similarly. Yes. Frankly, I wish we had an answer. We don't have an answer for why in that situation, why one identical twin would have such a severe illness, near death, and the other, quote, you know, as you mentioned, shake it off. There are some things that we're learning over time, though, that may help explain. So, you know, we don't want to get into the, you know, sort of details and histories of each of your nephews, but there could be some different sort of factors at play regarding how the virus was acquired that could explain, but right now we really don't know. I will say there was a story I think that we put out, Mike, you might remember, I believe it was on our local ABC about siblings. So not identical twins, but two siblings actually who became extremely ill, one after the other, and sound like what your nephew experienced and had to really be in the intensive care unit and were on this treatment called ECMO. And that was really when, you know, at the time when we were thinking that severe illness would spare children and teenagers and that it was more a disease of, you know, adults. So yeah, I know that had come out, but we haven't really figured that out as a medical community.
He did get better by the plasma transfusion. They did a couple of that procedure, and that helped him a great deal. So we have him home, but he still have a long way of recovery to this day. So yeah, but thank you for your input, and I appreciate it a great deal.
You guys,
thank you for sharing that. Thank goodness he's better.
Yeah.
Dr. Chapy, I got a question that just came through as a text. You spoke about droplets in air and the disease being airborne. We're coming up on a Labor Day holiday where people are traveling. What's your thinking on airplane travel and the closeness?
Yeah, that's a really tough one because, well, let me tell you what my guiding principles are. And this is for me more as a person as well, just like we are, and maybe I can be an honorary Rotarian, just at least for this meeting. So I certainly, what I've used is I have chosen not to fly. And you know, the question is why for me personally, why have I chosen that? And it is really because unless you're really one of those who can guarantee that your interaction and your distance is going to be maintained that entire time, that's not something that I was willing to sacrifice or risk. So to me, yes, I have heard many individuals who have gotten on flights and have been fine because there is mandatory masking. But you are pretty close to another individual, and it could be for a prolonged amount of time. I hear that airports are relatively quiet overall. So probably your in-person interaction or close interactions with others would be much less than it would be during a normal Labor Day weekend. But we don't have any official really recommendation as Inova. We haven't said to our team members, you may not fly. We have certainly asked that consider that it be for something essential. But at the same time, really, we've eliminated for business travel, we've eliminated all non-essential travel, which includes airlines. I know that we see from a lot of the airline industry, a lot of, I don't know the right way to put it, a lot of deals coming out, and definitely a lot of promises, certainly, that seem pretty reasonable. I have seen some from, and I don't know if am I allowed to talk about specific airlines? I've seen some from Delta and United that they have a very, seem very strong commitment to safety. But I personally feel as if things are a little bit too uncertain still to recommend and carte blanche say that air travel is a safe thing to do.
And I just add on to that, Chapy, you mentioned a few of the things that we've done as an organization. One of the things that I'm actually particularly proud of that we did for non-clinical employees, people who are not seeing patients like me, we're telework through the remainder of the year. And we did that. We made that decision, a few weeks ago. And for those who are going to the office, or if you want to go to the office, it's mandatory masking in all common areas. It's one stairway up, one stairway down. A few people in the elevator. I mean, it's all those things to keep all of our team members safe, so we can walk the walk as opposed to, in addition to talking the talk. And I'm really proud of that as an organization that we made those decisions.
Other questions? We have time for maybe a couple others. Well, Tintin, Past District Governor Tintin.
I just want to encourage all the Rotarians to donate blood. Mclean Club has its blood donation for years, more than 30 years. And it is so easy, and yet it is so helpful. Just to end on a positive note.
Amen.
We go our club goes quarterly. So thank you for mentioning that. President Ambreen, I think I saw your hand.
Yeah, I have one question, Dr. Chapy, since you have kids in school right now as well, like my kids are in school. And of course, they are starting in Virginia, as you know, virtual. So there has been a lot of controversy about kids getting COVID. And, half of the state is torn between opening the schools, and half of the state, but of course, our superintendent made the decision to stay virtual. As a scientist, what are your thoughts about that?
Unmute.
Chapy, you're on mute. I'll jump in on that, and we've had a lot of discussions. And of course, as a healthcare organization, we're obviously really concerned because our nurses, our doctors, they have kids in the schools, and they got to come to. And some folks, they have to come into work. They are essential workers. The challenge there is as a system, Chapy, provide whatever context you're thinking as a clinician. I will say as a system, as Inova, we have no position as to whether or not in school or not, or kids should be forced to wear masks in classroom if they're in school or not. That's a decision for the public health entities, the health departments, and the elected officials, right? That's why we elect school board members to really make those tough decisions. And I'm I'm glad that I'm not the one making that decision on behalf of a school system. But you know, that is a question we do get often. Chapy, now that you're off mute, you want to provide any additional context to that, or?
Yeah, I think the only thing that I would add is that, so you know, we live in Loudoun County. My kids go to Loudoun County Public Schools. They'll be virtual, both for, you know, for the foreseeable future. And, you know, again, this is me as Chapy Venkatesan speaking, not as Inova anybody, but when we did have the choice, we did make the choice for virtual when there was actually a choice. That's just me, again, just like the flying. I'm not saying this on behalf of Nova. I'm saying this on behalf of my family that actually I'm truly not in charge of, is my wife, but I'm a little bit in charge of. So, but really, I think that where this becomes really complicated, and this is where I would say the science falls short, because we can really talk through and probably develop some model about how likely it is that a child acquires infection, and then how likely it is that those become quote unquote super spreader events, and how likely that is to then move on to elderly or other folks and they have bad outcomes. But really, I think where the science falls short is you don't have something that consolidates all the science. Because I know there's also a lot of science about child development as well, and learning. And so all of that being able to be consolidated, honestly, maybe Dr. Jackson, she might know a thing or two, is graduating from Curry or being faculty at Curry. But I do think that it's a really, really tough one. I'm speaking just for ourselves as the Venkatesan household and the decisions that we made. I think from a scientific fact-based perspective, I think it is certainly possible that virus could be acquired through close contact, just like in any other situation. I personally feel as if I'm trying to think through when my kids were 8 or 10 years old, to actually keep them at a distance for the entirety would be a challenge. And we know that scientifically, if someone could acquire the virus and they're close to another someone, they can transmit the virus. So I would say that from a scientific perspective, those are all realities. But to translate that into a broader sort of what ought we to do when it comes to school closures and how we administer I think I'll choose Mike's answer, which is best for elected officials.
Thank you. We have time for one final question. I'm scanning the monitor. Rotarian Bilal, I see your hand.
Just a quick comment. Tintin said she was donating blood for many years. She's given 2 gallons to Fairfax Hospital over these past few years. She got an award for that.
And we can't be more grateful for that. That is fantastic. Thank you.
Thank you very much.
Well, thank you. You know, in the media industry, when we come to the end of a production, you know, we call it a wrap. And that's kind of where we are right now. But we do want to thank everyone. In particular, we've heard an excellent presentation from our community specialists. This particular virus, as Dr. Chapy has mentioned, has humbled, I think, all of us. But the good news in it is that we have come up or have seen collaboration. We've seen teamwork. We've seen great minds come together to look at how we can best fight this disease, or virus. So I want to thank you for bringing your time and your knowledge to the Rotary Club to help us to be able to be those partners that you talked about, and being ambassadors and spreading your news that we learned here tonight. So if everyone, please, would you please join me in giving Dr. Chapy and Michael a round of applause for an excellent presentation. And then from there, please help me to thank the Rotary Club of Falls Church for hosting this important event. Okay? I can't wait to see this shared amongst District 7610. There was a lot of great information. In fact, Dr. Chapy, you might get other calls, you know, to come out so you can continue to spread the news. So we want to thank you ahead of time, you know, for that. And on a personal note, I would like to thank President Rene, who reached out to me. He's my new friend. In Rotary, we have new friends every day, all day. In fact, we have new friends right now, Michael, Forehand, and Dr. Chapy, okay? And you don't have to stand and be honorary. You can come on in and join us. So we would love to have you. So we, again, come see us. All of us are available anytime you'd like to come out and see us. Well, my friends and our guests, I just want to say thank you again. Ordinarily, I tell you as a former high school principal, you know, to travel safely as you drive home, but most of you are already at home. So what I'd like to do instead then is leave you with some of my takeaways from tonight, and that is stay safe, stay connected with family and friends for that well-being piece of it. Stay happy and healthy as best you can in these times. If you're practicing all the things that we heard tonight, that can happen. Wash your hands, and I hear wash your hands often and for 20 minutes. So I hope that that's what, okay, I'm hearing that's good information. And wear your mask, not just for yourself, but for everyone else. So we're protecting each other. We're building each other up. And then watch your, and I'm going to stop saying social distance, watch your physical distance. I think I've learned something here too as well. So having said all of that, I will bid you all a great fair night and evening. Enjoy the remainder of the evening. And to our guests, we hope you'll come back and see us again.
Thank you for the honor and the opportunity to do so.
Thank you.
Thank you. It's a
Deborah.
great honor, and thank you for all the work you all do in passion and dedication. Thank you.
Thank you.
This is celebration. This is a celebration. When we do this, it's from the African tribe, Ashanti. When they do that, it's a celebration. We've had a celebration tonight.
Good night.
Thank you, Deborah.
I'm going to
Thank you.
start for Rene. Rene,
Thank you, Deborah.
thank you. Rene and Diane, could you just sort of stay on, please? Okay, thank you all.
Sure.
Awesome to see everybody.
Yeah.
Renee, you can stop recording if you haven't already.
Okay.